Namaskar. Welcome to the next episode of Clinical Ayurved. Myself, Dr. Mayuresh Agte. In last few episodes, we were discussing about Rasayan Chikitsa. We saw the conditions required in the body to get a good result of Rasayan Chikitsa. Then we saw some examples of dravyas according to that fulfillment of that conditions which are required for Rasayan Chikitsa. Then we discussed Rasayan Chikitsa after curing of a disease. In that case, we discussed that we have to consider the factors contributing in that particular samprapti, and then we have to choose the Rasayan Dravya according to that factor. So we have discussed some of the examples also in that case. In today's episode, I have taken 2 points. First is Vardhaman Rasayan Chikitsa and other will be Kuti Praveshik Rasayan Chikitsa. As a Vardhaman Rasayan Chikitsa, you all know, they have mentioned the Vardhaman Rasayan Chikitsa means to increase the dose of the Rasayan Dravya in a particular order up to certain extent and then gradually decrease the dose. They have mentioned different numbers also. For example, in case of Balla, the Charak has stated to start with the 10, then add 10. Sushruth had stated that start with 1 and after 5 days increasing 5 number, and Vapad has also quoted a different figure. My question is, can we change the number to start with? Can we change the number of increasing or decreasing order? And third one, can we change the duration of Vardhaman Chikitsa? In my opinion, answer is yes. Because thereafter they have mentioned by their experience. But patient in front of you is seen by you. You have taken the history of the patient, you know the intensity of the disease, you know all other factors like age, etc. So it is you have got right to choose this Vardhaman Rasayan as per need of the patient. So if one says that I can use Pipali to start with 3, I will increase in order of 2 and I will give the medicines for 10 days, 12 days and I will then gradually decrease in the same manner. Yes, you have that right to choose this Vardhaman Rasayan Chikitsa, the starting number, the increasing order and duration of this Vardhaman Rasayan as the need per the need of the patient. So Vardhaman Rasayan Chikitsa can be adjusted by our convenience. In the text, they have mentioned specifically about Balladak or Pipali that they are Tishna Ushna Aushadhi, and so when they are given in the Vardhaman format, then the body, it becomes easy for the body to get that assimilated and their Tishna Ushna Guna will not cause any bad effects. So they have mentioned in this Vardhaman Rasayan Chikitsa in the few drugs. But the next question is, can we use this Vardhaman Rasayan Chikitsa in other dravyas also? And in this case also, my opinion is yes. For example, we see during last episode that if a patient is cured after a disease which has got Tivra Agni, Agni is proper now, and to prevent the reoccurrence, we will give the Rasayan Dravyas on Jatra Agni. This will be our first line of treatment. But during that period of disease, the patient has lost weight, he has got very much strength wise he is weaker. So patient expects from doctor that he will give the medicines which will increase his strength, which will increase his weight also. In the last episode, we had discussed that Dhatu Vardhak rasayan dravyas are generally Madur Madur Shit Guru Snigdha. We have to use them to increase the weight in your patient, in this patient, but at the same time, they can give a burden on Jatharagni. Patient has given, already has recovered from the Jatharagni Mandir disease, and these dravya are difficult to digest, heavy for digestion, so they may give burden to Jatharagni. We are giving the medicines for Jatharagni, no doubt. We have seen it in last episodes. So we have to make the balance of, in this case, that you have to give the medicines to increase the weight, as well as they should not create burden on Jatharagni. In such case, can we use these dravyas in a Vardhaman format? And in my opinion, we can use them in Vardhaman format. For example, Chatavari, Vedari Gandhar, whatever you are going to use, they are Guru, Snigdha, heavy for digestion. So give them in an increasing dose. It will not create any burden on Jatharagni, as well as they will help us to increase the weight or strength of that patient. Now, this Vardhaman Rasayan Chikitsa can be used in any rasayan dravyas, and those can be adjusted right from tinge to spoon to tablets or in numbers, because you have seen the patient, you know the condition of the patient, and so you can adjust this whole schedule as per your convenience. Hence, Vardhan Rasayan Chikitsa is, in my opinion, the principle wise and practically also can be applied to all rasayan dravyas depending on the patient's need and patient's condition and Rasayagriya Vipak of that particular rasayan dravya you have chosen for the treatment. The next point of today's discussion is Kuti Praveshik Rasayan. They have mentioned principally that patient should go in that specific kuti, he should stay there for many days and take that rasayan chikitsa, and then he should come out after the process is complete. In today's era, in today's lifestyle, which is so hectic, it is little difficult to follow it at actual. But we all have seen the glimpses of this Kuti Praveshik Rasayan. Where and when? During the Corona period. In Corona, there were many patients which were positive for the Corona, but they were asymptomatic. And in that case, what they were suggested? Go to a room, kuti, remain in that room for few days and take medicines. And the medicines were multivitamins or Chyawanprash like, which we are increasing the strength, or a sort of tonics or rasayan dravya. Principle remains same. A patient goes to a room and keeps himself away from the external world and takes the medicines which will increase the strength of his body. So, in my opinion, in Corona period, we have seen the glimpses of Kuti Praveshik Rasayan. If someone follows it by the text, it is always welcome, but it looks difficult. So, in few last episodes, we have discussed Rasayan Chikitsa in detail and its clinical application. In next episode, we are going to discuss with the topic Medhya Karma, and at that time I am going to refer you 3 cases and we will discuss on these 3 cases in detail as they are in relation with the Medhya Karma. So, hope you have understand Rasayan Karma and its clinical application. Go to the text and add your number of Rasayanas in your diary and use them clinically. Thank you very much.